A very warm welcome to you all, and thanks for joining us today for the webinar, Addressing Disability-Related Costs Through Social Protection Systems. To begin with, I'd like to pay my respects to the First Australians past and present, to the Ngunnawal people on whose land I am speaking to you from tonight, and the land which was never conceded, and thank them for their persistence and patience. My name's Felicity O'Brien and I work in the Social Protection section in the Australian Department of Foreign Affairs and Trade. I will be your moderator for the discussion tonight. Tonight we'll have two sign language interpreters signing in international sign language, and along the bottom of the screen you will also be able to see the live captioning of the discussions. So to pin the interpreters on your screen for the duration of the webinar, please hover over the screen of each of the interpreters and you'll see 3 dots over to the left, and then select the pin screen option. To get your closed captions up on the screen, down the very bottom, you can see an option that says closed captions, and then hit view subtitles. So we'll also be recording the webinar tonight, which will include a full transcript and the slides, and this will go up on the socialprotection.org website in the following days. I'll also tonight be pausing between each guest speaker so that the sign language interpreters and live captioners can catch up. You can also join further discussions on the impact of COVID-19 and social protection issues by joining the socialprotection.org community. Find out how to collaborate and keep updated about future webinars by joining the community if you haven't already. So today's webinar is the second in a series of 3 disability inclusion and social protection technical webinars. And today our speakers will discuss the need for assessment of the extra costs of disability and the role of social protection systems in addressing these extra costs. Speakers will highlight the importance of collaboration with persons with disability and the representative organisations, and the importance also of building on social worker and carer networks for registration and determination, and the very important role of case management. You can also find the webinar recording from our first webinar, which was held on the 29th of September on the socialprotection.org website. And this one was part of the COVID-19 series. We will also be having our third webinar on the Tuesday, the 17th of November. And if you do join up to the socialprotection.org community, you will receive notification of when that webinar will be held. So we have a wonderful and diverse panel of speakers for you tonight. And I'll talk you briefly through the format that we're going to hold the webinar. So first of all, we will be hearing from Alex Coates from the UNPRPD, ILO and UNICEF Inclusive Social Protection Program, and Ludovicio Carraro from OPM. They're going to talk to us about the extra costs of disability and how existing social protection systems can be adapted to take account of these. Then in the second part of the webinar, we will hear from Bimbika and Merkel Lady from the Prospera program in Indonesia. And they're going to talk to us about some disability inclusion surveys and data collection activities that they've been undertaking. Then we'll have a short break and a question and answer session. And then we'll move on to the country perspectives and hear from Sawang, who's an independent expert from Thailand, and Joshko from Fiji, who are going to talk us through the innovations in the social protection systems in both Thailand and Fiji that they've been supporting. We will then also have another question and answer session at the end of the webinar. And we encourage you as the audience to send questions to the panelists throughout the webinar. Please use the question and answer function so that we can keep a real eye on what's coming through. And we will try our best to address all the questions during the Q&A sessions of the webinar. If we don't have time to answer all the questions, we will make sure that we take them on notice and get back to you with a document that we'll put up on the sp.org website when the webinar goes up in a couple of days' time. So I will now pass over to our first speaker, Alex, who will kick off the discussion tonight. Thank you, Alex.
Thank you very much, Felicity, and thanks for all of you to join us today for this webinar on a very important issue, where we believe that actually understanding disability-related costs and what social protection can do to address them is also shifting the paradigm towards a right-based approach to social protection, away from a focus on incapacity to work towards a focus on support to inclusion. So at the core of this idea of an issue of disability-related cost, we need to understand disability not as something that is embedded in the individual, but as a result from the interaction between persons with impairment and barriers that in their environment that may restrict their participation. And this is the definition of disability that is embedded in the Convention on the Rights of Persons with Disabilities. And those barriers in the environment are multiple and diverse. Could be physical barrier in infrastructure, in transport, information, the websites not being accessible for blind people, lack of sign language interpreters, but it can be also overly complex messaging documents that may not be made accessible for people, for instance, with intellectual disabilities. And around all those barriers, there are also attitudinal barriers that lead to discrimination and prejudice. And all those barriers generate cost. If I want to take the bus, but it's not accessible, then I have to take the taxi. It costs me more. So overcoming all those barriers generate cost for persons with disabilities and their families. Ultimately, they have to spend more to achieve similar standard of living and level of participation than those without disabilities. And the more barriers there are, the higher the disability-related cost. So when we talk about disability-related costs, they are diverse. We have first the direct cost, which come to mind is, of course, the wheelchair, of course, the crutches, the rehabilitation, but it also housing modification, the vehicles, the services we need, personal assistance, sign language interpretation, braille books. But it's also more expenditure on general items, for instance, healthcare, transportation, as just mentioned. And if, for instance, if you are parents of a child with disability, in many countries, the only services available in terms of rehabilitation and support are in the capital city. So if you want services for your child, you will have to move either to the big town or the capital city, where housing is much more expensive. The cost of this relocation and the premium that you pay to be in this location where services are available are disability-related costs as well. And in addition of those indirect costs, you have indirect costs, opportunity costs. For instance, we know that persons with disabilities have less education opportunity, less employment opportunities, and when they do work, they actually earn less than persons without disabilities. In their family as well, there is often significant loss of earning or education opportunity when family members have to reduce, stop work or education to provide care and support. So ultimately, we are in a situation where for the same income, households with persons with disabilities do not enjoy the same standard of living. They cannot save money, they cannot invest in productive activities because a chunk of this income is dedicated to disability-related costs. But there are some questions that we have, and the more we have worked on this issue, the more we realize that we have to be careful when we measure those costs. What is it that we really consider? On the left side, of the screen, I project the same picture I had before, where we have two households. The blue household doesn't have person with disability. The orange household has person with disabilities. And on the top, you have this set of goods and service that are currently spent for disability issues. And this is what people can afford. If you look on the right side, you have the set of household B, where you have also the blue and the orange household with and without disabilities. But here we are looking at not what people can pay, but what people would need in order to achieve equal participation. And when I mention equal participation, I'm talking about basic participation, going to work, going to school, accessing public services, participating in community activities. And if we look at goods and service required for participation, it's often far above and beyond what people can actually afford. So when we look and we seek in understanding and measuring disability-related costs, we need to be clear what is it that we are looking at. The current impact of disability on the household or the person, or the entire goods and services required to achieve basic participation. And as I mentioned, on the top of this, you have the estimation of the loss of income related to providing care or not having access educational opportunities. And if we look at some research that have been done, which are to date, unfortunately, very few, we have, for instance, in New Zealand in 2010, a very in-depth, interesting research where a diversity of persons with disability have been asked, what do you need to achieve basic participation and how much would that cost? And actually, if we look the different group, people with mental health, with higher support needs, with lower support needs, people with intellectual disabilities, hearing impairment, vision impairment, or physical disabilities, they cluster those different support and needs that they have into transport, equipment, and human support and assistance. And if we look at the scale, it goes from something like 250 for people who have moderate support needs and they have mental health issues, to basically 2,800 New Zealand dollar. And we can see the line that indicate the weekly minimum wage. Actually, some of those costs are 6-7 times the minimum wage. And it's very diverse depending on people with disabilities. And we see also that human assistance is often the most expensive support required. Here I project a graph from South Africa where you have a diversity of person with disability, blind person, deaf person, person with deaf blindness, and person with physical disability with moderate or high support needs. And you have, for each of those groups, 2 bars. One is blue, the other is orange. Blue is minimum participation. Those are the costs experienced by people who most of the time will stay at home and use unpaid care and support. Orange, the orange bar are for people seeking regular participation, maybe trying to go to work, going to school, using public services, etc. And often they will have to use paid support. While the blue bars, the minimum support is often under poverty line, except for people with physical disability and high support needs. As soon as people seek participation, disability-related costs are actually increasing tremendously. It doesn't cost much to stay at home and do nothing. But if you want basic equal participation, you will need personal assistance, you will need sign language interpretation, you will need transportation, and all these cost money for a person with disabilities. And we can see that actually quickly, it is 4 times, 7 times, 15 times the poverty line. So if we look at the income distribution in South Africa, who can really afford those disability-related costs? If we look at the minimum cost for a person with physical disability with high support needs, you have to be in the 7th decile. And if we look at the maximum cost for a deaf person, you have to be in the 10th decile. So basically, and this would be using your entire income just for the disability related cost. Who can afford? Not many. And I think this is a really important element when we talk about disability support from social protection and considering, for instance, poverty targeting. If you are in the 7th decile and you cannot afford the minimum cost with regards to a person with physical disability and eye support needs, shouldn't you get support from social protection system? If you look at high income countries, many of them provide very broad, if means test, it's very affluence tested, or it's universal support. So how do we address those disability related costs? As we mentioned, we can first think of removing barriers. If everything was accessible and inclusive, there would be much less barrier and therefore there would be less cost. This is true. And there are countries are working in that direction, but this, if it will have a big impact, it will take a lot of time and it will not cover everything. Assistive device, rehabilitation, those are very important for many persons with disabilities, but also for people with temporary injury, older persons. And more, it's included in universal healthcare, but we are far from what it should be. It's required and it will always be necessary. And then we arrive to disability-specific support, which include the support that people need today to overcome barriers, which can decrease eventually when the environment becomes more inclusive, but you will always have the support inherent to the personal functional limitation. For instance, if I need a personal assistance to move from the bed to the wheelchair, I will always need a personal assistant to do that. So those costs are fixed and permanent. Whether the environment is more or less inclusive will not make much a difference. Of course, if I have everything I need, the assistive device, and everything is accessible, maybe I will not need the personal assistant as much during the day. Maybe if there is a lot of barrier, I will need my personal assistants all the time. But in any case, I will need this kind of support. So what can be expected from inclusive social protection system across the life cycle for children, adults of working age, and an older person? Of course, basic income security. Coverage of healthcare costs, like for anybody else, but including rehabilitation and assistive device, as well as early intervention for children with disabilities. Think of parents of children with disabilities who spend a lot of money trying to understand what is going on with my child, what kind of support can I bring? And they visit many different people, traditional healers. All this cost a lot of money and can really drive people in poverty if they are not there yet. Coverage of overall disability-related costs, including access to support services, for instance, personal assistance or sign language interpreters. And finally, covering those disability costs that are related to accessing education or work. So what are the key issues we are facing? Mainstream cash transfer rarely factor disability-related costs. Disability-related cash transfer are often actually poverty or basic income security benefit that do not take consideration the cost of disability. They are often incompatible with work, conditioned by being assessed as incapable of working, and they ignore the fact that if you seek work or you keep work as a person with disabilities, you will face costs that other workers without disability will not face. And as most persons with disabilities that have the chance to work are doing so in informal sector, active labor market policies incentives such as tax exemptions for companies have very little impact. Basically, persons with disability bear the brunt of the cost. Let's imagine a person with disability who wants to sell something in the market. The cost of accessing the market will be much higher for a person with disability than for a person without disabilities. Who is covering this difference so that the bottom line of this small business is not hurt and is actually profitable and support the livelihood of persons with disability. Very often, disability support is also not compatible with other basic income support. I am an old person with disabilities. I have the old age pension, like any other old person, but I have other costs. But I'm not entitled to get the disability allowance and the old age pension, while I would need this extra money for my disability-related costs. As I mentioned, universal health coverage rarely include assistive device and rehabilitation. And concession, basically discounts, which exist in many countries, like discounts on transportation, discounts on museum, and or different activities, like in Philippines, on restaurants and other leisure and consumption goods. They are not always designed in a very progressive way and in a very evidence-based manner so that they have the best impact possible. And we will hear from all the speakers today the different options we have to actually progressively build social protection system that truly address disability-related costs. If you want to know more, there is a link in the a small video for training purpose, and there is a background paper we have developed on this issue with the UNPRPD program and colleague from Leonard Cheshire, and it's really made to engage in a debate with all of you, and we are looking forward to continuing this conversation with you. Thank you.
Thanks for that, Alex. Now we're going to move on to our next guest speaker, Ludovicio, who's going to continue on about the extra costs of disability. We might just have a little pause before he starts. Whenever you're ready, Ludovicio.
Yeah, thank you, Felicity, and thank you, Alex, for the good introduction. I requested control. Okay, now I received. Yes, so in my presentation, I will now focus on how to factor the cost of disability in a social protection program, focusing specifically on cash transfers. And the first step really to do this is to assess these extra costs and be able to express this in monetary terms or in adult equivalent scales. And once we have an understanding of what are the extra costs, then we can use that in the design of cash transfer programs. And I will speak of two main examples: mainstream programs that assess eligibility based on on income or an assessment of well-being, and then broad disability allowances that are provided regardless of any income test to all persons with disabilities. The fundamental assumption is that income is a mean to achieve a certain living standard and participation and inclusion. And this relationship, though, is different for people without disabilities and for people with disabilities, which means that in order to reach the same level of participation and inclusion and well-being, for persons with disability, there is an extra cost. And this cost depends on the type and severity of disability, the level of income, but also the level of service provision that exists in the country, the price structures, and so on. Which means that in every country, the calculation of this extra cost need to be tailored to the specific circumstances that we face. So in mainstream programs that determine eligibility based on a welfare assessment, in order to ensure equity, we should include additional costs faced by persons with disability. Unfortunately, these programs not always do this, as Alex mentioned, but these programs are really widespread. So they are either based on some form of proxy means test, for example, in the Philippines, in Pakistan, in Mongolia, there are these type of programs, or they are directly based on an assessment of income. And one form of this is a guaranteed minimum income scheme, which are also quite common both in developing countries, middle income countries, and high income countries. And what is fundamental in order to address equity issues is to assess welfare, take into account this extra cost. And the implication is both in terms of the ability to identify who really falls below a certain eligibility threshold, but also determining the level of support that is required. So if we look at this example where we have 5 households that have a different level of income per adult equivalent, and we assume that a mainstream program defines eligibility based on a certain level of income, we would see that there are 3 households that are eligible to support, and their support could be based on the distance from the eligibility threshold and their actual income. But let's assume that the 2nd and the 5th household have at least one member with disability. And what we need to do is to take into account this disability extra cost. This means that their actual income in comparison terms with other households will be lower. And so also the 2nd household will become eligible to some support, and the 5th household will require a higher level of support than if we didn't include the disability extra cost. So here I now discuss the case of Mongolia that, as I mentioned earlier, use a proxy means test to determine eligibility to some of their program, in particular the food stamp program. And a proxy means test essentially recognize that it's difficult to measure income directly, and use a set of proxies to determine the living standard of the household. And does this using household surveys and looking at the correlation between welfare and potential proxies. So in 2013, a study managed to determine the additional cost of disability with the available data, and so with some limitations. But that was the first step. And secondly, the existing welfare measures were adjusted to take into account this extra cost. And only at that stage, the statistical model was estimated so that the proxies that were identified took into account the actual situations of persons with disability, and also the way in which the proxies determine and measure the welfare have been revised. The result has been that many more people with disability and their family have been included in the food stamp program. In the second example, somehow I'm not able to turn, okay. Yeah, the second example, we look at Moldova. where there is a minimum guaranteed income scheme that determine an eligibility whenever a household has an income below a certain threshold. Once again, the first step was to estimate the extra costs that are faced by people with disability and their families. And a study in 2007 managed to assess specific adult equivalent scales, both for persons with disability, adult and children with disabilities. And these were taken into account to adjust the measure of income that the program was making. And again, the result has been not only to include more persons with disability in this mainstream program, but also to reflect the level of transfer to take into account this extra cost. Oops, I jumped one slide. Okay, there is some lag in the command. So the other main program that exists, of course, in terms of cash transfer are disability allowances that are provided regardless of income. And in the case of North Macedonia, before a reform that took place in 2018, the system was combining a set of means test benefits for persons with disability that therefore took into account the income of the household, with other benefits that for certain severe type of disabilities were provided to all persons with disability with such an assessment. And the reform that took place in 2010 was broad and look at all different terms, different type of social protection programs, both mainstreams, but also looking at disability allowances for people with disabilities. And the proposal has been to create a disability allowance that is given to everyone regardless of income, but considering the severity of disability and at least a certain degree of essential participation. The reform was not fully completed because relied on also on a transformation and reform of the disability assessment that the country employs, but the principle of universal disability allowance was agreed, and this also provided a change in the means tested approach for mainstream programs, that whenever a disability allowance exists and is of an adequate amount, doesn't require anymore to adjust for extra disability cost, but at the same time should also disregard the inclusion of a disability allowance in the means test. And finally, we need to recognize that in all these cases, the first step is the assessment of the additional cost of disability. And I want to mention the case of the Philippines because the Department for Social Welfare Development and UNICEF are engaging in a study that will try to measure this extra cost, specifically for families with children with disability. And the approach in this case allows to collect data and conduct a study to really understand comprehensively the cost of disability, looking at full participation for children with disability and their inclusion. And the ambition is that this study will then affect both the calculation of poverty measures, but also identify the needs of services and possibly further support in terms of cash transfer. And with this, I finish my presentation. Thank you.
Thanks for those great insights, Ludovicio. Next, we're going to move on to the session where we're going to hear from Bimbika and Mercolidi from the Prospera program in Indonesia. They're going to talk to us about a survey and some data collection activities that they've been undertaking to look at the extra costs of disability in Indonesia. I'll hand over to Bimbika now. Thank you.
Thank you so much, Felicity, and thank you so much for inviting us to share our experiences. We are delighted to be here and to share what we are doing and to have this opportunity to learn from all of you today too. So our work is focused on supporting our counterparts in the government of Indonesia with the design of fiscal policy on concessions and incentives. Indonesia's law number 8, 2016. Sorry about that, I had a childcare crisis. Our work is focused on supporting our counterparts in the government of Indonesia with the design of fiscal policy on concessions and incentives. Indonesia's law number 8, 2016 recognizes concessions as all forms of discounted fees provided by the government, local government, and everyone to persons with disabilities based on central and regional government policies. The implementing regulation for concessions and incentives are still being discussed. So our support is very much focused on evidence and analysis to support with this process. And we're doing a number of things which I've outlined, including updating profile and economic participation of persons with disabilities based on Indonesia's national data sets, identifying options for concessions, which is going to be the crust of my discussion today. And then based on that, estimating fiscal implications on state budget for each option and institutional arrangements for financing and implementation. So in this presentation, I will walk you through what we've done, what we've learned, and what we're going to do next. So next slide, please. So let me just reiterate how we understand, Let me just reiterate how we understand concessions and incentives, which is drawn on Alex's work as well. So concessions are a part of an overall package of social protection for persons with disabilities. And concessions and cash transfer, as Alex has mentioned, plays a complementary role. So cash is needed for those with significant support needs or disability costs, and those who are not in a position to work, or those who are living in less well-off households. Whereas concessions can provide additional support, such as free transportation, subsidized health, reduced utilities, and are critical for persons with disabilities in the missing middle, or those who are at risk of falling into poverty due to the extra cost of disability. So we started our work by better understanding the profile of persons with disability. Indonesia has very rich socioeconomic data sets that follow the Washington Group questions on disability. And these data sets allowed us to do all sorts of analysis, which we will be talking about, including better estimating the prevalence of disability. And here our analysis showed that approximately 8.6% of Indonesia's population, which is equivalent to 20 million people, ages 5 and above, have some sort of disability, and 2.1% have severe disability. Most people with lower threshold of disability have difficulties in seeing, but those with higher threshold have difficulties in walking. Approximately half of persons with disabilities have multiple disability. Persons with disabilities are living across Indonesia's archipelago, A slightly higher number live in rural areas compared to urban. And the prevalence of disability is higher among women and the elderly. So when we looked at economic participation, we found, as Alex also mentioned, that there are quite a lot of participation gaps. Very briefly, on the left-hand side, sorry for the small numbers, but I'll just walk you through. Very briefly, the labor structure flow chart on the left-hand side tells us that persons with disability are less likely to participate, actually 25 percentage points less. And even when they do work, their work is part-time, informal, and there's a big gap in earnings by disability status. We also find that having a disability affects labor force participation of other household members too, with households with persons with disabilities reporting that other household members are homemakers or others, this nebulous category called others, and this increasing with severity of disability. This implies that the need to care for household members with disability is having a bearing on the participation of other household members too. Finally, there are stark differences in education. If you look at the graph at the bottom, there's yellow and red colors in the bottom, which increases quite a bit once the disability status changes. And it also shows that 40% of those with severe disability have no schooling altogether. So now that we had a clearer idea of profile of persons with disabilities and gaps in economic participation, we were after what kinds of concessions would be the most useful for promoting economic participation and addressing these gaps. We started by reviewing literature on concessions and incentives in various countries, and we coupled this with more focused bilateral dialogue with government officials in Nepal, the Philippines, and Australia. All three are examples of countries that provide both cash and concessions to persons with disabilities. Having that dialogue was really interesting and important for all of us, as it allowed us to, as our work could be more informed by actual experiences of countries and based on what worked and what did not for them. We were also able to understand what is the best way to progressively introduce concessions. Based on these examples, all three countries suggested that the best is to identify options that would have the highest impact on persons with disabilities and their families and make them as effective as possible. This helped us to narrow the options that were under consideration. My colleague will discuss the current set of preliminary options that are being considered shortly. So when we started this work, there was quite a lot of concerns about how much concessions would cost and whether it would further burden the tax system, especially since Indonesia's tax to GDP ratio is low. So these bilateral dialogues were also very useful and enlightening. We found that the budgetary impact of providing concessions and incentives through the tax system is likely to be minimal because only a small number of persons with disabilities participate in the formal economy and or would be purchasing goods and services from merchants who actually pay taxes. Equally importantly, we learned that not all costs would have to be borne by the central government. It can be shared with the local government and the private sector too. More importantly, the budgetary impact would not be felt right away, as much would be dependent on the rolling out of credible digital ID system, as concessions would be offered to those who are officially identified as having a disability. And Indonesia is still in the process of developing such a system. So in terms of extra costs, in parallel, as we were having these dialogues and learning from what was happening in other countries, and also hosting discussions in Indonesia too, we've also been doing analysis on extra costs of living with disability using the standard of living approach, which my colleague Ledi will talk about shortly. And this is based on inferential analysis of Indonesia's existing national data sets. This was very this is a very important exercise as it helped us to show very clearly that households with the same income levels, same socioeconomic characteristics, would have very different standard of living depending on their disability status. And this is because having a disability comes with quite a lot of direct and indirect costs to families. But because we were relying on data that were not designed to estimate these costs, we needed a much more focused framework to better understand what the goods and services people across the disability spectrum required for basic social and economic participation. And are these costs being met or not? And how can measures to offset the costs or make them more affordable through concessions support with improving economic participation? And here, Alex and Daniel from the Center of Inclusive Policy have been working with us to adapt the goods and services required approach to Indonesia. And we're now finalizing the questionnaire, and piloting is about to begin on Monday. But in a nutshell, we are focusing on collecting data on goods and services required for basic participation. And here, the main parameters of basic participation are assistive devices for everyday life, accessing healthcare facilities, accessing educational facilities, going to work, participating in basic social life, including going for shopping or groceries. We start with a series of focus group discussions with experts to fine-tune our instruments and give us a set of responses to our questions to further test and validate. We then roll out the survey to respondents with different types of disability, levels of disability, demographic characteristics, location. The focus is really on capturing the diversity of experiences rather than choosing respondents randomly. So our counterparts are really on board with this approach as it is very focused and would help us first and foremost make sure that we're starting with the right sectors for concessions, reaching the broadest group of people, and the amount that we propose to subsidize or forego is based on goods and services that are required by persons with disabilities for basic participation. But at the moment, they cannot be met or fully met because of financial costs attached to them. Currently, the sectors being considered for concessions are assistive devices, health and education, transport, and utilities. So I'll now pass on to my colleague who will discuss the standard of living approach and preliminary options. Thank you.
Thank you, Bimbika. So next, okay. Right, sorry. So our initial calculation for extra cost is based on the standard of living approach. We do a regression to measure the standard of living gap by disability status using Indonesia's socioeconomic survey, SUSENAS, collected in 2019 March. The data collects information of functioning based on Washington's group short set questions, also slightly adapted, and also collects information on household expenditure and types of assets owned. The data also comes with complete information on the sample design, so we can calculate the reliability of the extra cost result. We regressed it separately over quintile and types of functioning, and we did the regression twice using two thresholds of disability definition. The lower threshold includes some, a lot, and cannot do at all response categories, and the higher threshold that includes just a lot and cannot do at all. The extra cost result comes in elasticity form, which means the cost comes in percent increase based on the conventional standard of living. The result can be seen on the table on the right, so here, separately over quintiles of functioning, over types of functioning and disability threshold. The percentage you see here comes from, interestingly, the lower quintiles, where their extra cost is also amongst the highest across all of the quintiles. But then, since it comes in percentage, usually people ask me about what would be the monetary value of this. One way to do it is to use the official poverty line the national measure of minimum cost of decent living varied across area of residence published officially by Statistics Indonesia. We then get the adjusted poverty rate shown as the bar chart on the left side of the screen. This graph shows some interesting findings. Firstly, even before the poverty line was adjusted, households with no members with disability, on the farmost left here, have lower poverty rate compared to households with members with disability. I'm just gonna focus on the higher threshold because that's the recommended threshold used by Washington Group. The higher threshold poverty rate is twice higher than household with no disability, where household with higher threshold disability has around 16% and household without has around 8%. But then after adjusting for the extra cost percentage, the higher threshold poverty rate soars into three times higher than household without disability. Indeed, our result bears some caveats. Firstly, the method we are using have not considered how the difference in cost of multi-disability versus single disability. Well, in the beginning, Alex showed that persons with multiple disability have a slightly larger cost than persons with single disability. Secondly, the extra cost is aggregated to total expenditure. So this result could not give advice over the size of specific benefits that should be given to Indonesians persons with disability. Such caveats can only be answered, well, may be answered through the goods and services as well as goods and services required study that Bimbika mentioned earlier. But we also did a situational analysis based on semester 2019. Bimbika mentioned that briefly about education and labor, but we also see what other kinds of socioeconomic outcomes where household with members with disability has not yet achieved, or how the socioeconomic profile of household with no disability member differ with household with members with disability. Based on the findings, we propose a concession scheme for health, transport, and utilities, where it could be given through top-up, so top-up for the transportation and utilities, subsidy for the utilities and health insurance premium, as well as assistive devices provision, because we in Indonesia it's not readily available yet, and also zero-rated imported tax. So these are mainly for imported assistive device, where most of the assistive devices that we got here is imported. So yeah, we propose to have zero-rated import tax as well. But this proposal is still on its preliminary stage. So our next step is to calculate the fiscal implication of the proposal. I think that is all we could share. And thank you so much for having Bimbika and I. Over to you, Alex.
Thanks, Bimbika and Mepalady. That was amazing.
Sorry, thank you, Felicity.
No, you're right. You're comprehensive survey and data collection activities and how they can relate to the poverty lines in Indonesia. It's a very stark kind of data collection exercise. It's also great to see how this data collection can add to the service provision of social protection and make sure that people with disabilities are able to receive the assistive devices and things like that that they need to take part in society. We're going to have a quick break now, but we would really like to get some question and answers from the audience for the first set of our speakers tonight. we've got one question that I can see coming up, but it'd be great for the audience to send in some more questions. So the first one is for Mercolady and Bimbika, and the question is from Ruben, and it is the disability support not integrated or included in the cash transfer program of Indonesia?
Lady, should I take a first shot and then I'll pass it over to you? So if you're disability support, as in if you're referring to concessions and incentives, it is at the central level, it's not included. The policy framework has just been developed and the implementing regulations are going to be drafted soon. But at the provincial level, at the municipal level, you do see quite a lot of things happening. As part of our work, we've also documented what are some of the good practices that are happening and how can it inform the options that we're considering as well.
Right. And also just to add up, so actually Indonesia has this cash transfer program for disability, so it's disability benefit, but the proportion is very small and it is only given to the persons with severe disability that are verified by Ministry of Social Assistance. The coverage itself is also very small, only consists of around 1% of the total social security benefit in Indonesia. So yeah, currently Indonesia is doing the roadmap for concession and disability incentives, and that's where our study comes in. So we are trying to show the governments of Indonesia like what would be the minimum cost that households with disabilities should pay in order to live equally with person without disabilities. I think hopefully that answers your question. Over to you, Felicity.
Thank you. We have another question through related to the Indonesia presentation. So back to you both again.
Okay.
Another question for the Prospera team. Is there an urban bias in solutions like prepaid public transport cards? And how would this work in rural areas?
Yes.
Okay, so
You go first,
you are correct, but actually what we're doing is right now, for instance, in Jakarta, the main public one of the main public transport providers does provide concessions for persons with disability. There are very few people who are registered in the and hence very few people who are benefiting at this point, but it is a facility that's available. So we are looking at that and whether it can be scaled up. But the main reason why we are also doing the goods and services required approach is precisely to understand what the transportation related costs are. And then look into what modes of transport people are generally using, and then have a wider discussion about, okay, what are the options based on these results? I hope I've clarified. Thank you.
Yes. Can I add this to this?
Sure.
So yes, I just wanted to say that Indonesia is a very big country where it has been decentralized since 2004. So actually, the basic services budget, provision even, comes to the subnational government. We have around 542 subnational governments in Indonesia. Each of them, they bear 60% of basic services provision. But the problem is not everyone has the same fiscal capacity. Well, the governments with the higher fiscal capacity are trying to initiate this concession and incentives for disability, right? Like Bimbika said earlier. And so we're trying to propose a situation that can be tackled first by governments with some fiscal gaps that they can do the benefits themselves without relying on the to the national government. I think that's all. That's all.
Thank you. Alex and Ludovico, I have a question for both of you. I wondered if where you see in context where the extra costs of disability are not being met, have you seen some good examples of some community-based organisations or community-based structures stepping in to take the slack?
Thank you very much, Felicity. Indeed, I think in many countries, you have community-based rehabilitation program or community-based inclusive development programs, which to some extent are seeking to address those issues. And you would have in many countries, for instance, provision of assistive devices that are carried out by NGOs. You would have organizations trying to remove barriers in the community. One of the big challenge of this approach is, of course, the whole issue of universal access, because CBR programs are usually patchy in terms of coverage. So if you are lucky enough to live in a village or a community where the program happened, you might actually get the support. But if you're not, you will get nothing. And one of the critical areas for social protection and this combination between cash transfer and concession is to basically provide coverage, to go where NGO cannot be. And one of the hope we have also is that this whole conversation on disability extra cost will lead also to more cooperation between community-based rehabilitation program and cash transfer program. For instance, imagine a cash transfer that are directed at families with children. If we identify better, like in the Philippines, the cost of disability for children with disabilities and their families, and what kind of support they need, then there would be more opportunity and more understanding for cash plus service intervention, which today exists in the field of nutrition, for instance, but not in the field of disability services, or very, very rarely. So we really see, we don't believe that cash transfer or concession will do it all. You really need also community-based organization to work together with the social protection system to provide this comprehensive support.
Yeah, and I've seen also that there have been some question posted on the chat rather than the QA. There was specifically a question about the contribution that family members provide to assist a member with a disability. And I think that in some countries, there are programs that recognize those contribution and provide also an allowance to all the family members who provide that support. So it's a personal assistance allowance that is provided to a family member that takes care of a child, for example, that has a disability. And that programs could be partly a solution, yeah, to that goes some way to recognize that effort, and is both in terms of a response of a support that is provided to that person, but also recognize that those years that are spent to look after a household member with a disability are considered in terms of pension rights as well.
Felicity, just one question I wanted to tackle, because I think it touched upon which really important is when means tests are done for social protection, very often it's the household income that is considered. And we have here an example from Canada saying that an unemployed woman with disability cannot access social protection schemes because her husband's salary is more than enough. But what about independence? What about the choice and control that one will have over his life? And this is really something that is extremely important. And when we talk about understanding extra costs and having a rights-based approach to social protection, is really understanding also that persons with disabilities have the right to make their own choices. And if the social protection system consistently reinforces dependency on family members, then it doesn't help. So we need to strike a balance, and it is some of the issues we are trying to tackle. How do we support household to support persons with disabilities while also fostering choice and control and autonomy of persons with disabilities themselves in line with the Convention on the Rights of Persons with Disabilities?
Great, thank you, Alex. Yes, that is a particularly good point that you make there. Thanks everyone for the questions. We'll move on now to the next part of the webinar, and we will hear from our country representatives. So we've got Sawang from Thailand, and then we'll have Joshko from Fiji who will speak next. I'll hand it over now to Sawang from Thailand to start his presentation. Thank you.
Thank you, Felicity. Can I have my presentation, please? Okay, thank you. Today, I'm going to talk about how social protection in Thailand can address the disability-related extra costs and how we ensure the standard of living of persons with disabilities in Thailand, according to Article 28 of UNCRPD. And by the way, I'm going to use my own abbreviation for disability-related extra costs to save time. So if you hear or see DREX, that is it. It's not moving. Next, please. Okay, thank you. So there are 5 sections in my presentation. So first, I will you will get to know the number of persons with disabilities in Thailand, and then I will show you the social protection programs that we have. And next, I'll talk about some of the key challenges of DREX. And in the last 2 parts, I will talk about the potential DREX in employment and recommendations. There are 2 sources of disability statistics in Thailand. So the first one comes from registration, which is updated every 3 months. And as of June 2020, around 2 million persons with disabilities, or 3% of the total population have registered and had a disability card. And the other source is the survey on disability conducted by the National Statistics Office in 2017. And the survey reviews that we have 3.7 million persons with disabilities, or 5.5%. It also reviews that there are many persons who have mild disabilities and cannot register, and a few of them who wish not to register, and very few of them who did not know the registration system at all. In the past 3 decades after the first disability law enacted in 1991, the current Disability Empowerment Act effective in 2007, has taken social protection in Thailand to the next level. And now persons with a disability card are eligible for many social protection programs, such as disability allowance, old age allowance, child benefit. And these three first benefits are concurrent, which means you can have more than one of them at the same time. The disability allowance is more successful in terms of coverage, as 97% of persons with disabilities registered had already received it. We also have income support in form of the government welfare card, the employment quota, which is 1%, and services for the unemployed and the underemployed, as detailed in the National Security Act, which I will not go into detail today. Persons with disabilities also enjoy access to essential social services. For example, the Universal Coverage Scheme, which covers the cost of healthcare, rehabilitation, assistive devices, medical supplies. Next, we also have support for independent living, which cover the cost of essential daily and social activities, education, and we have food security and housing. Although many social protection programs are universal, a few of them still target poor people. And more importantly, there are many social protection programs that need assessments before granting access. And for example, all persons with a disability card are eligible for the household accessibility improvement. However, in practice, mostly poor persons with disabilities receive the support. We also have support for those who need a personal assistant. However, we only have 1,417 personal assistants or PAs nationwide. And one piece of research on personal assistants in Thailand reveals that one PA serves 3 to 5 persons with disabilities in the province. And in that province, there are only 15 personal assistants available. So undoubtedly, only 4 out of 2,500 persons with disabilities have access to the PA service. By the way, PAs work no more than 6 hours per day and receive around $1.6 per hour. Next, please. As a person with a disability myself, I also witnessed how social protection has decreased my dregs, especially in transportation, which is the sector that I work in most of the time. So now most public transport gives a discount or free ride if you have a disability card. However, your disability card can be meaningless if public transport is not accessible. In the past 10 or 20 years, I spent around $400,000 per month for taxi services, and that is 130% of the national minimum income wage. And as years go by, and with our never-ending advocacy, I can see more and more practical stations starting from 13% in 1997, 61% in 2020, and the new lives beyond 2020 will have 94% practical stations. And there are also some, of course, there are criteria for of practical station, but I will not go into detail. Now I spend less than $40 per month for transportation, which is 90% cheaper. It really saves my life. And I remember how hard it was just to get one elevator for a train station back in the 90s. Now we have several elevators, which I could have never imagined. Anyway, it makes my life a lot better. Here are some of the key challenges on dregs in Thailand. So first, we have not widely discussed or explicitly mentioned dregs in any disability laws. Second, we have no definition of dregs. And in combination with that, we then cannot measure how much support a person needs. And while we are moving toward the rights-based approach, some social protection programs are still seen as generic social welfare, which may not be tailored to individual needs. And lastly, our payments are still low which cannot cover all the drags. So, for example, the disability allowance is only 9 to 10% of the national minimum wage. This is my hypothesis. The lack of drags support may have led to indirect employment of persons with disabilities in recent years. This is how the story goes. The current Act has 3 articles on employment. Article 33 is direct employment, which means hiring persons with disabilities in real workplaces. Article 34, employers pay a levy instead of hiring, and we get a lot of money from this. And Article 35, considering accessibility issues in workplaces, in public transport, and in education, indirect employment may be a better solution because hiring persons with disabilities to work is too costly. So why not hire them to work in their own community? Now, many companies have turned to Article 35 for this reason. In the picture, this is an example of a bank which hires persons with disabilities to raise awareness on the Don't Drive Drunk campaign. And every day, these employees go to different places, showing signboards saying, "Don't drive drunk." And at the end of the month, they receive around $300. No training is required, and they can do it right away. Good. And like it or not, many persons with disabilities have changed from family's burden to family's economy. I can tell you that there are numerous variations of Article 35 now, you can imagine. And the only problem is they do not have a decent job and fringe benefits as do typical employees. So we need direct support. Next, thank you. Direct support is one key element that will enable persons with disabilities to work under Article 33, which is direct employment. Based on the model of the access to work policy in the UK, there are several costs that we need to take into consideration, such as cost of traveling, assistive devices or equipment for work or for personal use, accessibility assessment or workplace assessment, support workers, for example, job coaches, personal assistants, and sign language interpreters, physical and mental health support, that is not covered by the UCS, and disability awareness, disability equality training for workplaces, cost of moving equipment to any workplace, and other support as appropriate. And to ensure proper support, we must include social protection and DREX in our disability laws. Why? Because if we have no laws, no action, and no money, I think the best time to do it is the next 5-year National Disability Plan, which will be formulated in 2021. Also, we should encourage more research, discussions, and debates around social protection and DREX to build knowledge and design solutions. And most importantly, we must continue to improve and increase accessible infrastructure. If you cannot go around, your disability card is near useless. Okay, this is all of my presentation. Thank you for your attention, and over to you, Felicity.
Thanks so much, Soang. Thanks for the insights to your personal experiences with the transport costs and the difficulty with getting around in Thailand. It really puts the discussion on extra costs into perspective. Next, we're going to hear from Joshko from Fiji, and then we'll have another quick question and answer session at the end. Over to you, Joshko. Josh Curry, do we have you on the line? I can't see you as one of the panelists.
Felicity, if Joshko is not here, maybe I can briefly go through a few slides and then we can go to the question and answer.
Yeah, sure. If that's okay, Alex, that would be great. It looks like Joshko isn't on the video chat. Thanks.
Maybe. Thank you very much. So Joshko wanted to share with you some of the work that they have been doing as organization of persons with disability in Fiji in advocacy and work with the government to build the social protection systems that actually support inclusion of persons with disabilities. So in 2012, there was one major program in Fiji, which was the Family Assistance Schemes. It was a poverty targeted cash transfer, which come with a food voucher for a poor household. In 2013, there was a reform where the Family Assistance Scheme actually was transformed in the Poverty Benefit Scheme, which is still for poor families and a combination of cash and food transfer, a food voucher. But in addition was a care and protection schemes for family with children who may not be below the poverty threshold, but may still need support. And this CPS was compatible with the poverty benefit scheme. In the same time, there was also a social pension schemes for senior citizens above 65 that do not have a pension. So that was created. And in 2018, to those three schemes was added the disability allowance scheme, which is a universal disability allowance for all persons with significant disability. The design of the disability allowance is really the result of consultation between government and organization of persons with disabilities. And from the start, the focus of the disability allowance was coverage of disability extra costs. Today, it's 90 Fiji per month. And persons with disabilities that are living within family entitled to and receiving the poverty benefit scheme can receive the disability allowance because it's an individual benefit and it's non-means tested. And if they are working, they are also eligible for the disability allowance schemes. So the whole idea of the disability allowance scheme was we need to support people with their extra costs, whether they live at home, they are working, because we acknowledge that actually those extra costs are a barrier to employment. And it was basically breaking a little bit the logic of saying we need to support people with disability on the basis of incapacity to work. And we know that in many countries, there are schemes like this where the criteria to get disability support is incapacity to work. And it put people with disabilities in an all or nothing situation and tell them the choice you have is stay at home, do nothing, get a pension. But if you try to work and seek economic participation, you will lose all the support. And the DAS was designed to break that kind of logic. As some limitation, it's compatible with work and the poverty benefit, but it's not compatible yet with old age pension. And if you are a person living alone, you have to choose between the poverty benefit and the disability allowance. So there are limitations in the compatibility, but if you live in a household who gets the poverty benefit, you can still get the disability allowance. The rollout has been fairly fast. In actually 2 years, they reached 8,662 beneficiaries, which for Fiji represent 1.4 of the working age population. And in terms of expenditures, they moved from 0.05% of the GDP to 0.1% of the GDP. So it's again for the Pacific, the highest investment in a social protection benefit. But the disability allowance is not the only scheme. There is also a monthly bus fare concession. There is a program for economic empowerment with seed funding. There is free healthcare provided by public hospital and partial subsidies for catheter and medicine. There is a new housing scheme to support accessibility of housing and water and sanitation needs of persons with disabilities. There is some direct provision of free of charge prostheses and crutches, and there is a DPO private partnership to support access to assistive device. And despite the COVID-19 crisis, which has had a catastrophic impact on revenue for the government, there is still ongoing conversation to explore the different possible format for home support and partial personal assistance schemes to provide, as we know that human assistance is the most expensive cost that people face. And those were actually photos of persons with disabilities registering or participating in meetings related to the disability, the universal disability allowance. Thank you.
Thanks so much, Alex. Thanks for covering off on the Fiji example there. And I'd also like to shout out to Joshko for all the work that he has done in Fiji in promoting the Universal Disability Allowance and advocacy work across the Pacific too. So we're getting short of time now. We've got about 5 minutes left for questions. So I have a couple more questions here for the panelists.
Oh, Josh, network is bad. See, it's yeah.
So I might direct this question to possibly Alex again. Sorry, Alex. Persons with disabilities are often working in the informal sector, and I was wondering if you've seen any good examples where there have been programs that are built into the social protection system to promote skills development and micro entrepreneurship programs. And that question's from Ruben.
Thank you very much, Felicity. Actually, I saw that Josh was just coming. So maybe, Josh, could you present briefly the economic empowerment program in Fiji? Because actually it's one program that's mainstream, but also help persons with disabilities starting business and engaging in work. Could you give in 1 minute some element around it? Joshko? Disappeared again. Okay, so they are actually in many countries, you will have programs with regards to livelihood for persons with disabilities. There are some issues though. For instance, in many countries, you will have fairly outdated vocational training for persons with disabilities. There has been tremendous effort in the recent years to, for instance, work on financial inclusion. What kind of mechanism can be found to ensure that microfinance institutions actually are inclusive in their consideration of the support for a person with disability starting business. There have been, for instance, schemes with regards to guaranteeing the loans that are made. You have organizations like, for instance, Sightsavers, Humanity and Inclusion, Light for the World, and many others that have invested a lot in supporting those kind of work. One of the challenge, though, that we mentioned is the fact that you might have the money or the resource or the skills to engage in a livelihood activity, but the extra cost you face in carrying this activity day after day might not be covered. And actually, like I was mentioning, access to market for a person with disability is a big issue. If I'm a deaf person, what kind of interpretation I will get? I will need a proxy to sell my product. If I'm a person in a wheelchair, I might not be able to reach the market, etc., etc. So how this is covered, and this is where, for instance, we believe that a universal disability allowance could really help actually people engaging in livelihood activity and making the most of schemes that are promoting livelihood activities. There are also in terms of concession, you have countries or local governments that will waive market fees, or the tax that you pay to be able to sell your product on the market. So that would be some type of exemption. In India, for instance, you have concession where you will be exempted of the fee to have a small cart in front of a touristic landmark, etc. So it's trying to give somehow a competitive edge to persons with disabilities in their livelihood activities, because they face some of those extra costs. And what is actually important is thinking combination. A disability allowance alone is not enough. Concession alone is not enough. Livelihood alone is not enough. You need to combine. And if you think of, for instance, high-income countries who have quite generous schemes, usually they have this combination of concession, cash transfer, and services. Because when we look at the goods and services required to ensure basic participation, they are above and beyond what any, I would say, disability allowance or cash transfer in low and middle income country, even in most high income country, could do. So you really need those combinations to work all together.
Thanks, Alex. I've got one last question that we'll go to before we wrap up tonight. So Ruth has written in a question, and she has asked if these kinds of concessions and extra costs can be described as a cash plus tool of social protection. My understanding is that accounting for these extra costs allows persons with a disability to participate on par with their peers in society and evens out the playing field. But it'd be interesting, Alex, to see what your view is on that.
Thank you very much, Felicity. Actually, indeed, that's what we are calling for, a cash plus concession, cash plus services package. However, it's important to remember that countries are in different places in terms of social protection system development. And for instance, if you look at Vietnam, you will get some concession if you are eligible to the cash transfer. But what happens if you are not eligible to the cash transfer? You will get nothing. And I think what's really important, I think Bibinka really presented that very well, is this issue of ensuring that on the continuum of person with disability and the diversity of person with disability, everybody gets some support of some forms, because all persons with disability face disability extra cost of some kind and of some level. So what we are basically kind of promoting is, for instance, having a set of concession, including affordable healthcare and assistive device, but also free public transportation on utilities for all people with disability that are registered. Because we know that unlike Thailand, where 97% of the people registered have access to the disability allowance, some other country will not go that route, not now. And I think what Ludovico was mentioning, some countries today do not have disability allowance. They have poverty means tested schemes like Fiji had in the past. And if you look at Indonesia today, they have the PKA, which is this poverty schemes. There is a disability top-up, which tomorrow could become a disability allowance, but today it's attached to the poverty assistance schemes. So what we are promoting is really a combination, but avoiding the everything or nothing package, because this leave people in the missing middle, leave people that didn't make it in eligibility determination for cash transfer without any support. So and as Ludovico was saying, and this is why we wanted also to share all the work that Bibinka and the team of Prospera have done, you need evidence. You need to understand who might need what. What is the best balance you can do between cash, concession, services. And this is specific to every country because every social protection system has a different starting point. Thank you.
Great, thanks so much, Alex. Apologies that we've gone a little bit over time. We do have a couple of questions that haven't been answered, but we'll endeavour to answer those and get the answers up on the website with the webinar recording over the next couple of days. I also invite you all to answer the post-webinar survey. The link will be available in the chat screen shortly. It'd be great if you could fill that in for us. And we hope that you can join us for the third webinar in this series on inclusion of persons with disabilities in social protection systems for COVID-19 recovery and beyond. And we'll be holding that on Tuesday, the 17th of November. More details will be coming up on the socialprotection.org website over the next week. Thank you so much for joining us, and we hope to see you again on the 17th of November. Also, don't forget to become a member of the socialprotection.org community. We've had a few questions tonight about how people can collaborate with other social protection policymakers. This is a really great way to do that. And I would like to give a big shout out to our wonderful expert speakers tonight for sharing their time with us. And thank you also to the interpreters and the captioners. Have a good night, and we'll see you again on the 17th of November. Thanks. Good night.